بسم الله الرحمن الرحيم والصلاة والسلام على سيد المرسلين سيدنا Muhammad وعلى آله وصحبه أجمعين. This is Imam Iman Tahir, a member of the College of Psychotherapy of Ontario, as well as a member of the Canadian Counseling and Psychotherapy Association. In this short video, I want to address a very important issue that comes to my attention a lot. People call me about someone or about themselves who hear voices and see things that others are not able to see or hear. And they think the best way to deal with it is to seek ruqa shar'iyya, or to find an imam who can do Quranic recitation and healing for them. Now, as an imam, I do strongly believe that Quran is a healer for everything. وَنُنَزِّلُ الْقُرْآنِ مَا هُوَ شِفَاءٌ وَرَحْمَةٌ لِلْمُؤْمِنِينَ. That's out of the question. We don't doubt this fact that Quran is a healing for all our sicknesses. But what we need is to find someone like Umar al-Khattab who can put his hand on the sick person and recite the Fatiha, and by the will of Allah Azza wa Jal, everything will be gone. Alternatively, what we need to do is to be realistic. My advice to people like this would be go to see your family doctor. Your family doctor will be able to assess what do you have, and based on it give you medications that can help you to stabilize the chemicals in your brain. Or they will more likely be referring you to another specialist, which is a psychiatry, a medical doctor who's trained to deal with the brain sickness. And they will more likely will be putting the patient on medications that stabilizes the chemicals in the brain and deal with these symptoms that are exhibited in their life. After some time, when things become more stable, then this person would need what we call psychotherapy. And the most effective psychotherapy tool to deal with this issue would be what I personally use, and I call mindfulness cognitive-based therapy, which is using cognitive therapy within the perspective of Islam. So using the Quranic perspective and the ahadith and dua and ayat, but within the tools of psychotherapy. This is the most effective way to deal with people who are dealing with these issues. More likely they're to be diagnosed with schizophrenia. But we don't like to use these terms which make people sometimes feel that they're being stigmatized. We don't like to use a stigma and put it on people's forehead, but rather we need to direct them to the right direction rather than causing more pain for them in their life. So please, if you know someone or you're yourself dealing with something like this, first thing, go talk to your family doctor, have him or her to deal with the issue from medical perspective, and then after that your medical doctor will be telling you, go seek psychotherapy, and this is when you need to find someone like myself or someone who's trained in this area. May Allah Azza wa Jal give shifa to everyone who is sick, and may Allah Azza wa Jal help us to live our life according to the deen of Allah Azza wa Jal. Jazakumullah khairan. Wassalamu alaikum wa rahmatullahi wa barakatuhu.